Welcome back to our 5 nursing tutorial YouTube channel. In this class, we are going to discuss with another new topic, that is fetal development. Fetal development. What happens here after fertilization? Here after fertilization. After fertilization, zygote is formed. A single cell zygote is formed. And then after that, single cell zygote is converted into 4 cell zygote. After that, 8 cell zygote. And then after that, 16 celled zygote. Zygote, this is called morula. This zygote is called morula. This morula takes enter into the uterine cavity with a fluid filled. That is called blastocyst. That is called blastocyst. And then this enter into the endometrium of the uterus, and then it is going to implant. That is called implantation. After that, development starts. Fetal development starts. We'll see the development of fetal week by week. Don't skip the video because this topic involves highly important points. Okay, we'll see week by week. That is first 1 to 3 weeks. At 1 to 3 weeks, what happens? This fetal development. Here, embryo is 1.5 to 2 mm in length. This is during first to 3 weeks. And then blood circulation begins usually at 21 days. Blood circulation begins at 21 days. And then cardiac activity is seen on ultrasonography at 21 days. And then neural tube becomes spinal cord and brain here. And then this is about 1 to 3 weeks. Next we'll see at 5th week. 5th week or at 5 weeks. Here double heart chambers are visible. Double heart chamber are visible, and then heart is beating usually at 28 days. Already I had done video on this one, class on fetal circulation. You can watch that one. Later you can understand this. Here double heart chamber are visible, and then heart is beating usually at 28 days. Next we'll see at 8 weeks. Fetal development at 8 weeks. First, embryo is 3 cm in length, and then weight will be 2 gram. And then circulatory system through umbilical cord is well established. It is well developed circulatory system, that is to the umbilical cord. And then organogenesis begin. Organogenesis means generating organs. Organogenesis begin. And then embryo starts looking like human. This is important. This one is asked in a competitive exam. In which week embryo looks like human? That is at 8 weeks. Next we'll see the fetal development at 12 weeks. At 12 weeks. Here fetus weight is approximate 20 gram. Weight at 12 weeks. Fetus weight that will be 20 gram. And then kidneys begins to form urine. That is per day 650 ml. 650 ml per day urine production. That is in the fetal at 12 weeks. And then spontaneous movement occurs. And then heartbeat is detected by Doppler between 10 to 12 weeks. And then gender is visually recognizable. And then liver start to making red blood cells at 12 weeks. Next we'll see at 16 weeks. Here fetus weight, that is 100 gram. Fetus is 100 gram, and then active movements are present at 16 weeks. Active movements are present. And then lanugo hairs begins to develop in 16th week. That is at 16 weeks. Lanugo, soft hairs. Lanugo hairs means soft hairs. Begins to develop at 16 weeks. And then the pancreas and liver start to produce contractions. That is at the 60 weeks. Next, we'll see at 20 weeks. Here, fetus weight is 300 gram. That is at 20 weeks. And then lanigo cover the entire body. Lanigo cover the entire body, and then muscles are developed, and then heartbeat is detected by fetoscope. Here it is important. In which week we can detect heartbeat by fetoscope? That is at 20 weeks. And then fetus get C. meconium. Meconium, first stool. Next we'll see at 24 weeks. Here fetus weight is 600 gram and then length, that is 25 centimeter in length. And then vernix caseosa covers entire body. Here vernix caseosa is nothing but it's in a whitish creamy substance to protect the skin of a fetus. It is present on the skin of a fetus, that is called vernix caseosa. And then fetus has ability to hear, and then fetal bone marrow begins to make blood cells. That is at 24 weeks. Next we'll see at 28 weeks. That is, limbs are well flexed and then eyelids open and close at 28 weeks, and then brain is developing rapidly. Rapid development of brain will be present at 28 weeks, and then fetus weight is 1000 gram, 1 kg. And then lungs are developed sufficiently to provide gas exchange if born. And then at 28 weeks of gestation, known as viable period of fetus. Here at 28 weeks of gestation, that is known as viable period of fetus. And then footprints and fingerprints are forming at 28 weeks. This is all about the at 28 weeks. Next we'll see at 32 weeks. Here fetus weight is 1800 to 2100 gram, and then bones are fully developed at 32 weeks. And then here lecithin sphingomyelin, that is L is to S, that is 1.2:1 ratio. Here lecithin sphingomyelin, it is a surfactant. It is going to provide the maturation for the lungs. It's going to provide maturity for lungs. Next we'll see at 36 weeks. At 36 weeks, here fetus weight is 2200 to 2900 gram, and then height is 35 centimeter. Skin is pink and body is rounded. Skin is pink here, and then lanigo is disappearing. Lanigo will be disappears, and then LS ratio, that is lecithin sphingomyelin ratio, is greater than L stays this is 2:1. Normal level of this one lecithin sphingomyelin is 2:2.1. If it is lesser than this, it is indicated as lungs are not properly matured. That is, it's a normal range of lecithin sphingomyelin, and then term baby is 37 to 42 weeks. We call this one as a term baby. Now we'll see at 40th week or 40 weeks. Here fetus is 40 to 50 centimeter in length at 40 weeks, and then fetus is more than 3000 gram, that is more than 3 kg, and then vernix caseosa decreased. This is a whitish creamy substance to protect the fetus skin, and then fingernails extended beyond. Here fingernails extended beyond fingertips, and then testes are in the scrotum if that is a male baby, and then labia majora are developed if that is a female baby. This is all about the fetal development week by week. I hope you all are clear with the topic, and then don't skip the video, watch till end, because mainly this topic contains highly important points. If If you like, please share and subscribe to my YouTube channel. Thank you for watching.